Welcome to the latest edition of Cardiovascular Updates, covering recent breakthroughs in the field. Brought to you by Lucid Quest, this update highlights: Edwards Lifesciences' Sapien M3 has received the first US approval for a transseptal transcatheter mitral valve replacement system. Indication: symptomatic moderate to severe or severe mitral regurgitation, including mitral annular calcification with MR or MS, in patients unsuitable for surgery or TIR. The system is fully percutaneous via a transfemoral transseptal approach. In the ENCIRCLE single-arm pivotal cohort cited by the source, investigators reported MR reduction and symptom gains. Expect this to shape prescriber choice and payer reviews as full data mature. Cytokinetics has secured US approval for Myqorzo, aficamten, for adults with symptomatic obstructive hypertrophic cardiomyopathy. The MAPLE-HCM study showed improvement in exercise capacity per the source. The risk evaluation and mitigation strategy allows earlier titration, with echocardiography checks 2 to 8 weeks after a dose change and maintenance echoes every 6 months. The label and REMS are positioned as more flexible compared with Camzyos in the source summary, which may reduce logistical burden and influence adoption. Stereotaxis has US clearance for the MAGIC robotic ablation catheter, indicated for mapping, pacing, and ablation of supraventricular tachycardias in congenital heart disease, where manual access is limited. Magnetic navigation is designed to improve precision and stability for complex electrophysiology cases, signaling continued investment in EP robotics. Acesion Pharma has launched a Phase 2 trial of AP31969 in atrial fibrillation across 8 European countries. The design is randomized, double-blind, placebo-controlled with 200 patients. This oral SK channel inhibitor targets rhythm control. The primary endpoint is AF burden, measured as time in AF, with continuous monitoring via implantable loop recorders. In the PROTECT study, the first patient in the United Kingdom has been treated with a TIMP3 graft gene therapy during coronary artery bypass surgery. The approach applies a viral vector to safe venous vein grafts ex vivo, aiming to strengthen the grafts and reduce failure. Early recovery is described by the source. Outcomes are pending. YorLabs reports the first clinical use of its intracardiac echocardiography system after 510K clearance. The Zero CapEx platform provides high-resolution 2 DICE, with 4 DICE in development. The initial real-world case took place at OHSU during atrial fibrillation ablation under single operator control and integrated with existing workflow. A Journal of the American College of Cardiology linked analysis summarized by the source highlights US trends. Hypertension prevalence was flat from 2009 to 2023, yet hypertension-related cardiovascular deaths nearly doubled. Diabetes prevalence and related deaths also increased. These data can inform practice discussions and payer evaluations, while interpretation will depend on study design and control of confounders. ARPA H has announced ADVOCATE, a program to catalyze patient-facing and supervisory agentic AI for cardiovascular care. The goal is an FDA-authorized system that integrates wearables and EHR data, supports scheduling, lifestyle guidance, prescription management, diagnostic support, and escalation to clinicians with a supervisory safety agent. Stay ahead in cardiovascular research. Like, share, and subscribe for our updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next